Good afternoon. It is 4 o'clock on Tuesday, one day closer to defeating this pandemic. And it's that time that we come together to remember that we will get through this and we will get through this together. Let's start off today with some good news, and then we're going to roll through a number of different topics. Yesterday, with Brigadier General Hal Lamberton, I was honored to sign 3 pieces of legislation into law that benefit our brave Kentucky National Guard soldiers and their families. These bills were supported in both chambers of the state legislature and will help better serve those who bravely serve our Commonwealth and our country. Every year, the work of the Guard is crucial to our state, but in this last year, the Guard has been called out time and time again, from historic flooding, an ice storm, and helping through the pandemic in many ways. They have answered the calls and helped. First bill I signed was House Bill 73. This new law authorizes a state-sponsored life insurance program for the Kentucky National Guard's men and women through the National Guard Association of Kentucky. With this change, state-sponsored life insurance program representatives are available to provide Kentucky National Guard units with program briefings during annual trainings, drill weekends, and otherwise to educate members on the program benefits. The legislation also permits the U.S. Defense Finance and Accounting Service to manage program payments by service members. The second bill, House Bill 196, prohibits vehicle insurers from refusing to issue motor vehicle liability insurance policies and enacting penalties against uninsured deployed service members. In other words, you can't be penalized in your ability to get car insurance or the penalties that they can assess if you are deployed at the time. It ensures all deployed military personnel are appropriately covered and protected. And finally, House Bill 206 is very important to help supporting adoption in Kentucky. And the new law immediately helps increase adoption assistance program reimbursement by $2,000 per child for our military families. With this change, Kentucky military families can qualify for reimbursements up to $7,000 for a child with special needs and $5,000 for any other child. I want to thank all of our soldiers for their service. I was pleased to sign these bills that recognize their sacrifice, help protect them, and again, encourage the growth of our Kentucky families. So today, I'm also proud to share good news for one of our own. Despite the challenges of this year, many Kentuckians have become closer as we work together for the greater good. One person who helped us along the way, it's actually over here, is Virginia Moore. Virginia taught us the importance of inclusion while making us all smile when we needed it the most. She used her talent and skill to keep the deaf and hard of hearing community informed, teaching all of Team Kentucky a lesson as we work to build a better and more inclusive Kentucky together. I'm honored to share once again that others saw Virginia's compassion and commitment, and we're celebrating her today through 2 separate awards. The first is from the Greater Clark County Schools Educational Foundation in Indiana, which is Virginia's school district growing up. The foundation hosts an annual Champions for Children, recognizing some of Greater Clark's finest. This year, they appropriately named Virginia Moore as the 2021 Jeffersonville High School Alumni of the Year for her service throughout the pandemic. They called Virginia a champion. And although her work is silent, it speaks volumes. I completely agree. Here is a quick message from your former school, Virginia.
So on behalf of the Greater Clark County School Education Foundation and Greater Clark County School District, we'd like to say, congratulations, Virginia!
Oh, pretty neat, and we're not done yet. The second award is a very special one. It highlights the importance of communicators and the impact they've had for the greater good. My father, former Governor Steve Beshear, received this award in 2015. I'd like to point out it took him 8 years as governor to achieve it. I was honored to receive it last year. For me personally, it means a lot to be in the same category with my dad, but also with Virginia Moore. on behalf of the Kentucky District of the National Speech and Debate Association, I am proud to present Virginia Moore as Kentucky's Communicator of the Year for 2021. Virginia, this award typically takes place at a ceremony where future leaders are selected to represent the Commonwealth at the national tournament. But today, you're teaching the importance of your work as we help to build a better Kentucky. Congratulations. And I'm going to continue to kid Steve Beshear, if that's okay with you. That's pretty special. You didn't know that was coming, did you? All right, let's continue to talk about good news, and that is vaccines. If we can show table 1, as of today, we have now provided at least one shot of hope to 1,026,047 Kentuckians. Think about that. We celebrated the millionth person vaccinated yesterday, and we haven't slowed down one bit. And if we show table 2, yes, this last vaccination week, we not only we shattered a record with 165,217 Kentuckians getting their shot of hope. That is incredibly exciting. It beat the next closest week we had by almost 40,000 doses. This is a credit to not only everybody who's worked to set up this system, but to everybody doing the vaccinations, to those signing up and getting in their car wanting to receive their shot of hope. We need to keep that up. And to keep it up, we wanted to point out 2 locations that have appointments available. We're going to start doing this just like we did in testing. When we start seeing slots available at certain places where things aren't booking up quickly, we want to point them out for people. So in Bowling Green, there are slots available at Med Center Health. If you go to the website, medcenterhealth.org/vaccines, you can see the process to sign up. Go there right now and schedule your shot of hope. Pikeville Medical Center 2, pmcvaccine.com. These have been set up to primarily help the region, but they are open to all Kentuckians. So anyone who is looking to get their shot of hope that hadn't been able to get scheduled thus far, that could make appointments in these locations, please feel free to jump on. We want to schedule every appointment, everywhere, every week. The faster we can get people vaccinated, the faster we're done with this thing, but also the faster that people are protected, the faster that they are safe. All right, a little bit of additional news today. We're going to call in Dr. Stack. We believe that we have detected a new variant here in Kentucky. It has impacted a nursing home in eastern Kentucky where we have seen those not vaccinated and those vaccinated become infected. He'll talk to you about the good news is those that have gotten it, that have been vaccinated, have not gotten seriously ill. But this is something that we just have to watch as we move forward, and we're seeing some other examples in different states. Dr. Stack?
Good afternoon, Governor. Good afternoon, Kentucky. So I'm providing an update today on a nursing home outbreak that we're currently responding to. In this nursing home, we're presently aware of 41 persons who have tested positive for COVID-19. The situation is still unfolding, but I'm sharing this particular example today because there are some important lessons that we can learn from it. At this facility, 85% of residents and 48% of the healthcare staff were vaccinated. It appears that an unvaccinated person brought COVID-19 into the nursing facility. Currently, of the 41 persons infected, 27 of them are residents and 14 of them are healthcare workers. Notably, of the 41 infected persons, only 30% of the vaccinated individuals have been symptomatic, but a much larger 83% of the unvaccinated people have been symptomatic. So vaccination appears to have markedly reduced symptomatic disease. Additionally, 5 of the residents have been admitted to the hospital. Of these, 4 hospitalized residents have been vaccinated. I'm sorry, were unvaccinated. Please correct that. Of these, 4 hospitalized residents were unvaccinated, and 1 hospitalized resident has been vaccinated. So here too, vaccination appears to have markedly reduced the risk of serious infection and hospitalization. So now I'm going to make that even more clear. There were 71 people who were vaccinated, 1 of whom is in the hospital. There were 13 residents unvaccinated, 4 of whom are in the hospital. The proportion here is notable. It's a really big difference. So there's a few important observations to take from this. 1, increased vaccination uptake among all staff and all visitors to nursing homes, and in fact, people visiting any vulnerable population, is urgently needed to reduce the risk of introducing COVID-19 into these vulnerable populations. Number 2, vaccination appears to be doing exactly what we hoped it would, protecting people from severe illness and hopefully protecting them from death for those who have become sick. Number 3, it is absolutely imperative that all persons, whether they're in long-term care facilities or in the general public, continue to practice the public health measures we've talked about, specifically wearing a mask whenever you're in public, socially distancing more than 6 feet, washing your hands and covering your cough, and if you're sick, stay home until you feel better. We've all got to do these things until everyone is vaccinated. And when it is your turn to get vaccinated, please get a shot of hope. Please get vaccinated. It's the single best thing we can do now to help ourselves escape from this pandemic, which has so upended our lives over the past year. Until we all get vaccinated, you've got to wear your mask, socially distance, and wash your hands. It's absolutely imperative. All of us have an important role to play in this pandemic. And I want to thank you. It's been a long journey, but Kentucky's really rallied together. And if we all get vaccinated here over these next couple months, we have the best chance of minimizing the risk of this disease spreading, and also of minimizing the creation of new variants or mutations, which could cause us further harm in the future. Thank you very much, Governor. Back to you.
Thank you to Dr. Stack. Obviously, we are watching this situation, working with the federal government. Dr. Stack and his team got a great compliment from them about how closely they work with their federal counterparts, being one of the better states in that area. Overall, in long-term care, it is good news. If we can go ahead and bring up that slide a little earlier than we normally do. Just 2 new positive cases on today's report, 3 new staff, and through our auditing process and being able to dedupe and continuing to make sure everything's accurate, we actually have 5 less deaths as we went back through the data, and that's certainly good news there. Remember, this Thursday, we ought to have our audit of the time period of especially November through the end of January, going through each and every death certificate that lists COVID, ensuring that it's in our reported numbers. It will add to our total. When Ohio did this, they added 4,000. We're not going to be anywhere close to there, but we'll have that report out on Thursday. Again, it's the right thing to do. There are no unknown soldiers in this battle, and everyone who's been ripped from us, from this painful, difficult virus, deserves to be recognized, and their families' grief to be recognized. So we're going to continue to go over the data and go over it and make sure that we have it right and that we know the full devastation of this virus, both in Kentucky and nationally. And you're going to see the same out of every other state that makes that same decision to honor those we've lost by ensuring that all of our numbers are accurate and everybody is counted. Today's numbers, 819 new cases of COVID-19. That's the lowest Tuesday in about a month. Hospitalization are down 5, ICU down 4, Kentuckians on a ventilator because of COVID down 8. Our positivity rate is at 3.87%. I think we've only had 1 day since September, and that was in March, that has been that low. We only have 9 red counties. I think that's up 1 from yesterday, but still such a low number of red counties. We are reporting 24 new deaths today, which is far too many. Now, only 3 of those are members of long-term care. They include an 86-year-old man from Ballard County, a 90-year-old woman from Bell, a 51-year-old man from Boone, an 81-year-old man from Boone, an 86-year-old woman from Boyd, a 61-year-old man from Boyle, an 88-year-old man from Bullitt, a 63-year-old man from Campbell, an 88-year-old man from Campbell. From Fayette County, a woman and 2 men, ages 82, 62, and 74, a 63-year-old woman from Gallatin, an 81-year-old man from Jefferson, 2 men from Kenton County, ages 64 and 72, a 63-year-old man from LaRue, a 79-year-old man from Lincoln, a 65-year-old man from Marion, 2 women from Mercer County, ages 82 and 84, a 70-year-old woman and a 91-year-old woman, both from Pulaski, and an 81-year-old woman from Whitley. Some of these are historic. The majority of these today are all from March. All right, now to give us an update on the latest COVID outbreaks in Kentucky's correction system, we have the Executive Secretary of the Cabinet, Michael Brown.
Thank you, Governor. It's been about 6 weeks since I last came and gave an update on the situation of COVID in our prisons, and I always like to give some context to show how these are progressing. It was February 3rd when I gave the last report, and if we could call that up on the screen, you can see the numbers as they were, and that was on February 3rd. 43 deaths and 6,884 inmate cases. If we fast forward now to a month past that, March 3rd, we can see a slight spike in the inmate cases, about 300 or so, 1 additional death. The staff deaths stayed flat, and the active staff stayed flat, and actually the inmate actives decreased. 2 weeks later, when we get to today, we can see that there is a significant spike in the inmate cases and in the inmate active cases. There have unfortunately been 2 additional deaths since March 3rd. Inmate cases up over 700, but those are accountable from 2 institutions. 11 of our 14 institutions have no active cases right now, but we do have a serious outbreak at the Kentucky State Penitentiary. And if you look at that 628 active cases, 555 of those cases are accounted for at the penitentiary, the other 70 at the Weston Correctional Institution. Same thing mirrored with the staff. 30 of the 48 active cases of staff are at the Kentucky State Penitentiary, and 12 are at Western Kentucky. As of today, we have 3 inmates that are hospitalized. But there is, as for the rest of the state, Governor, hope on the way. We had already announced that we were setting up to vaccinate inmates over 70, and those vaccines will ship to hopefully start next week if there's no interruption in the shipments. But even better news, all 14 of our institutions have now been enrolled as a vaccine distribution point, and they are going to be targeted for the Johnson & Johnson vaccine as we get supplies in, which means we'll be able to start vaccinating inmates at all 14 of our institutions with the Johnson & Johnson vaccine as it becomes available. That's going to be a significant game changer, just as it is for the rest of our population. Timetable on that will obviously depend on supply, as always, and as soon as we get those supplies and we get a better schedule, I'm sure we'll come back and update everybody on that. Thank you.
All right. Our last topic of the day is going to be one that is going to surprise you, though maybe nothing should surprise us during COVID. And it's one where when you hear the word, you You're going to have to breathe a little bit, but we should be used to that. What I'm going to do is give an update on what we are doing with regards to the recent outbreak in 2 countries in Africa about Ebola, and tracking with the CDC travelers that are in Kentucky that have been in those areas during the outbreak. Now, we've gotten really good at this through COVID, and we don't believe that there is any significant risk at the moment. But we are, and we want to be transparent about it, making sure that we reach out to anyone that we learn has been in these areas where the Ebola outbreak has been. As of this morning, we have 11 individuals in Kentucky that have been in one of 2 countries. That's Guinea or the Democratic Republic of the Congo. Local health departments and contact travelers, and they assess their exposure risk. They educate them about what symptoms they might have, and they quarantine those at high risk for 21 days, though we have not had a single person in Kentucky that is at high risk. Here's the Ebola situation as it is occurring in these 2 countries. In the Democratic Republic of the Congo, February 7th of this year, we had the first new Ebola case announced. There are 12 confirmed cases, 11 probable. That have been 6 deaths. In Guinea, February 14th, the outbreak was announced. 14 cases confirmed, 4 probable, 9 deaths. These are nearly identical to a 2014 to 2016 strain. I've seen some things in the news where they believe it might be a survivor of that early strain. Cases are rising very close to where they broke out originally. If we could show the map just to give you a concept of where these 2 countries are. Guinea is obviously a little more northern than the Democratic Republic of the Congo. So folks, again, this is something that every state is doing. It is hitting the news. 11 individuals in Kentucky had traveled to these areas, and when we learn about more, we reach out each and every time. Again, we do not have anyone at high risk thus far. Even with that, we believe in being prepared. So we're working with our hospitals right now to make sure they are ready to handle any suspected patient for within 12 to 24 hours of us learning about it. We have 6 Ebola assessment hospitals that we are working with to make sure they're prepared to handle any potential patients and assessments for Ebola. So we believe that as much as you can be for something like that, we are ready, but that the risk is low. But I want you to know that we're on top of it. After COVID, reading some of this in the national news could rightfully get you worried. We've all wondered what could come next, because it seems like we're hitting one thing after another. But we're on top of this one, and we will continue to be. All right, with that, we will open it up to 1, 2, 3, 4, 5, 6 journalists we have with us today. We will start with Corinne Boyer from WEKU.
Hi, Governor. Can you hear me?
I can.
Oh, okay. Just making sure. So in Kentucky, people with intellectual and developmental disabilities aren't included in any of the vaccine plan phases, with the exception of Down syndrome. But both West Virginia and Ohio include people with developmental and intellectual disabilities in current or previous vaccine phases. I know Kentucky follows CDC guidelines, but will Kentucky consider including people with intellectual and developmental disabilities in its current vaccine phase? Why or why not?
Well, first, I think you hit it right on the head. Our phase 1C is nearly identical to the federal government's with 2 changes. One, ours includes clergy as essential workers, and we do not include smoking as a reason that you can get to a higher priority. And so the reason it's not included in Kentucky is it's not in the CDC prioritization. But with that said, we should consider it. And given that you've raised it, we will consider it and give it some real thought. And then after we've had a chance to do that, we'll make sure we get back to you with our reasons and rationale. But I think that's something we should certainly look at. Next is Tom Latek with Kentucky Today.
Good afternoon, Governor, and Virginia. Congratulations to you on your awards, if you don't mind me doing that. At the beginning, you talked about a new variant that appeared at the nursing home in Eastern Kentucky. Which variant is it?
So it's a new variant. We do not believe it's the UK variant or any of the others, and they're seeing certain variants in different places. We don't know if it's going to be widespread at all, or if it's just there. So it's really, really early. Let's turn it over to Dr. Stack to add anything that he has.
So thank you, and thank you, Tom, for the question. So I'm going to not give too much detail on the genetic mapping yet, because that's a complex analysis that's still underway. But what we do know is that it is not one of the common variants, the ones we associate with United Kingdom or South Africa or Brazil, but it is a cluster, and it looks like it's the same infection in a group of these individuals. And so what we'll do is genetically sequence all of these, map it out, and compare it against the larger database that the sequencing labs report to, and then see if we can find any patterns or any lessons we need to learn here. But I think the point that the governor mentioned in his remarks is we have to be very attentive about this, because the more opportunities we allow the virus to spread, the more people who get infected, the more opportunity it has to mutate and eventually find combinations that help it to be more dangerous. So the good news is that the vaccines appear to be doing their job in protecting people. The important news going forward is everybody's got to continue to get vaccinated as soon as you're able to and eligible, and continue to practice those public health measures we keep reminding people of. Governor, back to you.
Steve, can we bring him back? Okay.
I'm here.
Steve, I think Secretary Freelander just shot me a message. When we expanded 1C to its current form, did that include Kentuckians with intellectual disabilities from the question just asked?
So the CDC guidance, the reporter was correct. It talks at the top about individuals with Down syndrome, and then the second category are individuals with neurologic illnesses, including dementia. It does not specifically reference individuals with intellectual or developmental disabilities. The good news is, though, as we've discussed, we anticipate with the increased vaccine moving very quickly through these next few weeks. So I think hopefully this will be addressed very soon.
Okay, and as we had said to Corinne's question, this is something that we're going to take back and consider very carefully. Thanks, Steve. Next is Sarah Ladd with the Courier-Journal.
Yes, thank you. So regarding the variant outbreak, can you say which facility in Eastern Kentucky that was? And then also I was going to ask, does the state do any kind of tracking on infection rates or deaths among the houseless population? Is there anything you can share about that? Thank you.
I think it's too early, given we are still learning more, to identify the specific facility. It is in Eastern Kentucky. It is only one facility. And then as far as the houseless population, I certainly know that there are vaccinations starting in Louisville. Let's turn it back over to Dr. Stack to see if we have any specific tracking amongst that population.
So for the homeless or housing unstable population, it is a little bit difficult to track all the individuals. They don't have mailing addresses and physical street addresses typically. But we are working with the local health departments, and the local health departments often have connections with shelters, and the shelters clearly know a lot of the individuals who have unstable housing. And so we are supplying vaccine, and now as we are going to get more Johnson & Johnson, we will supply preferably Johnson & Johnson, so that we have the opportunity with one dose to give the homeless and the housing unstable populations access to the preventive vaccine. So the tracking is a little bit more difficult done locally, but we supply the vaccine as the quantities allow for the local health departments and to work with shelters and others who advocate for the homeless to address that population who are particularly vulnerable. Governor?
Next is Mike Valenti from WLEX.
Thank you, Governor. Good afternoon. We heard from a viewer yesterday who called us after seeing WDRB's report about people getting help with unemployment due to messages from people in your administration, most notably Lieutenant Governor Jacqueline Coleman. I know you've already addressed this, but this person, I'm sure there are others who are frustrated because in this case, she had an appointment with the unemployment office yesterday and said she never got a call. Can you understand how some people might read that story and perceive that there are individuals in Kentucky who are getting preferential treatment based on who they know in the administration? And what would you say to those people who are still struggling with the unemployment system?
Well, first, I understand the frustration of anybody who hasn't been able to get the help that they need. That's what the unemployment system is set up for. Obviously, it was not maintained in good times. And then the largest amount of unemployment filings in human history happened. And when you don't support your systems, when you don't replace an IT system that runs on pre-DOS platforms that was put into place when I was in college, where previous administrations and sessions cut 90-something people and significant amounts of its budget, it becomes very difficult. Now, if you want to ask about people's personal text messages, you'll need to talk to them. But here is what we do when we get in letters. That's the form that I get them. Other people get calls from county judges, from mayors, the media. Every station sends us names and they say, can you do a check on these? We send them through to a contact like Constituent Services when we get complaints in the Capitol. And then when they can, they pull those and check on them. That's something that's been asked of us of the media and of other folks. Now, nobody's position should change anybody's outcome about whether they qualify or whether they don't qualify. But to everybody out there, we want to get you help as fast as we can. And I personally, I haven't had any friends or family reach out or have issues or having filed. But I understand everybody out there deserves help and deserves it now, deserved it several months ago. And I can understand, frustration only grows when there's, perceptions that they're not getting the attention that they need. And if you haven't been helped, you're not getting the attention that you need. So we need to continue to push hard until absolutely everybody gets help. Chad Hedrick from WKYT.
Hi there, Governor. A question about with the Johnson & Johnson vaccine. We spoke to health officials in Moorhead yesterday saying that they would like to see that particular vaccine handed to more rural communities because it's difficult for people to travel to these areas to get that booster shot, and oftentimes maybe someone doesn't even come for it. Is this something that you all are looking at when you distribute this vaccine of which areas would benefit more from just a one-shot dose versus having to come back for the booster?
So first, the White House Coronavirus Task Force has tasked us with an equitable distribution of all forms of vaccines, meaning that in every region of the state, all 3 vaccines are available. With that said, there are certain programs and areas and providers that the Johnson & Johnson vaccine is advantageous to help. So our independent pharmacies, which are primarily in parts of rural Kentucky, are receiving the Johnson & Johnson vaccine so that they can service their customers when they come in to get other services as well. Certainly the homeless population, we'll be looking at it eventually for migrant workers and others. So there are some specific programs where we're going to be able to say yes for Johnson & Johnson, but the clear directive from DC is that you can't take all of that and put it in just one or another area. And we're hearing a lot of demand for it, a whole lot of demand for it, which is really encouraging because I believe it's going to become probably the dominant by volume vaccine that we end up having near the tail end of this. And so it's exciting that it's here. It's exciting that people want it. Yes, we're going to be looking at opportunities where it is advantageous for the individuals while still making sure that it's in every part of the state. Bruce Maples for Kentucky Health News. Welcome to Bruce Maples.
Thank you, Governor, and good afternoon. I have two quick questions. The first one is, with the prisoners being vaccinated, Michael Brown said they were being vaccinated if they're over 70, but in the rest of the state, now we're vaccinating people over 60. Why are we not doing that with prisoners? Why are they our lower priority when they're actually more at risk? And the second question is there anything in the budget to pay for genomic sequencing to find these variants? And if not, how are we going to get it done? Thank you.
So on the prisoner side, we're doing a two-part vaccination plan. The first is those that were in 1B. That process is getting underway and will be underway. And then as we get Johnson & Johnson, because we have people that leave those facilities that aren't going to come back to that facility to get their second shot, that'll enable us to run that program. And we believe supply, hopefully soon, will allow that to happen. We have money to do genomic sequencing through CARES Act dollars and other dollars that come in from the federal government. We don't have it specifically in our budget, but those are dollars that come down from the federal government that are appropriated by the federal government for those specific purposes in our testing and in our vaccination plans. All right, we got through another Tuesday. Remember that this week, while we are so hopeful, this virus is still out there. It is still dangerous. This nursing home in Eastern Kentucky certainly shows us that we need to continue to be wary. Please wear your mask. Please engage in social distancing, and do it even and especially if you've been vaccinated. If you've been so lucky, a part of that 1,026,000, you have a duty to everybody else who is still waiting for theirs. So again, make sure that you're doing your part. Love your neighbor as yourself. Protect one another. We're going to get through this every day. Every day we're providing these vaccines, we are one step closer. And remember, May 31st, we believe we'll have every Kentucky adult who wants a vaccine will have gotten at least their first shot of hope. And we believe that we will beat the president's plan to open it up to everybody 16 or 18 and older, depending on the vaccine. Certainly before May 1st, we believe we'll have a schedule for that on Thursday. So a lot that we'll talk about on Thursday. We'll see you then.